Mrs. Fumi Alabi.
Okay, good morning, everyone. Good morning, good morning.
Morning.
Thank you, everyone, for coming on here today for our fibroid seminar, our 5th fibroid awareness seminar. Unfortunately, we had to start this seminar this way by having a 1-minute silence for our general manager, who we lost sometime in October. It's a very, very sad one for us. But we just had to put this together because we do know and appreciate that this is something that she's passionate about, and wherever she is, I'm sure she'll be very happy that we're still doing this today. So have a wonderful time, everyone. I'll just hand over to my colleague, Miriam Adu. Thank you.
Hello, everyone. Welcome to the Africa's biggest health webinar of the year. My name is Miriam, and I'm so excited to be your anchor for today. This annual fibroid event is brought to you by South Shore Women's and Children's Hospital. And this year's theme is Conserving the Fibroid Uterus, Options and Management. Ladies and gentlemen, in the next few hours, we are going to be providing all you need to know about fibroids. Trust me, this promises to be insightful, engaging, and fun. Before we proceed with our session for today, I'd like to recognize the presence of an astounding woman, a philanthropist, and a successful entrepreneur. Ladies and gentlemen, please welcome with me Our Excellency, the First Lady of Ogun State, Mrs. Bamidele Abiodun.
Thank you so much for inviting me to the 5th Annual Fibroid Awareness Seminar today, the 4th of December, 2021. I would like to thank the organizers, South Shore Women's and Children's Hospital, and their partners for this very, very important initiative, which affects millions of women at one point or another in their lives. It is also gratifying to note that the issue of women's health is beginning to gain a lot of attention, not just around the globe, but also here in Nigeria. One major thing, which is true across Nigeria, is that many health issues affecting women, including the uterine fibroid, have a social stigma associated with them. I do believe that the more we talk about these things that affect us personally, the more they make their way into mainstream conversations, either on the news or on forums like this. I strongly believe in a collaborative approach in dealing with women's health. When we involve NGOs, the medical community, government, the media, and international donor organizations, we can reduce the negative and sometimes fatal consequences of being silent. What I find, and what a lot of experts agree on, is that the more attention is paid to a certain issue, whether social or health related, the quicker we can find lasting solutions to them. I'd like to close because I wouldn't want to take too much time. We have a lot of deliberations ahead of us this afternoon, which we're all eagerly looking forward to listening to. I'd like to close by pointing out the fact that the high cost of treatment for many diseases affecting women is still a huge setback for many women in our communities. The past month, we increased our advocacy for breast and cervical cancer across Ogun State with the aim of providing access to care for women who are affected by the disease. With the support of development partners, philanthropists, and the private sector, the high cost of care, even for fibroid procedures, can be reduced. Technology plays the most critical role in the detection and treatment of not only fibroids, but other diseases as well. It also helps to reduce costs when the condition is detected early. Once again, I'd like to thank South Shore Women's and Children's Hospital for the opportunity to be here and actively doing something to help our women live healthier lives. Thank you very much for listening.
That was a wonderful speech from Our Excellency. Thank you so much, Ma. Thank you. South Shore is feeling so generous this afternoon We are giving 10 free scans to 10 lucky winners right now. So to win, listen to the steps. You must be following us on Facebook and Instagram at South Shore Lagos, step 1. Step 2, take a screenshot of this event right now. Step 3, post the screenshot on your story with caption hashtag SSWCH Fibroid Webinar 2021 and tag at South Shore Lagos. The first 10 people to follow us with the instructions will be announced winners shortly. We would dive just straight into the business for today. You'd be surprised some people still don't know about fibroids. If you ask some of your neighbors or colleagues what fibroid is, I'm sure they will tell you little or nothing about it. I didn't know about fibroid until I was 19 myself. So there is this aunt of mine that I used to think was pregnant. For 3 good years, she had this bulge in stomach. To cut the long story short, out of curiosity, I asked and she told me it was fibroid. It was then I began to research about it. So without wasting so much of our time, please allow me to introduce a specialist in this field. She's a senior colleague, more like a boss to me, a consultant, obstetrician and gynecologist at South Shore Women's and Children's Hospital, a fellow of the West African College of Surgeons and the winner of the Bello Osagie Prize for the Best Candidates in 2018. Our interests are in the maternal medicine, infertility, fibroids, and other benign gynecological conditions. Let's welcome Dr. Mary Beckey as she tells us all we need to know about fibroids.
Good afternoon to everyone. On behalf of South Shore Women's and Children's Hospital, I'd like to welcome everyone to our 5th Annual Fibroid Seminar. I'm going to be talking to us today all we need to know about fibroids, and I'll try to be careful with the time so I don't bore us with too much talk. Permit me to share my slides now. This is the outline I'll be following. I'll talk about what fibroids are, what the causes or risk factors, how do they present, how do we make a diagnosis of fibroids, how are fibroids managed medically and surgically, what are the newer techniques available today, eliminating the stigma, which the First Lady did mention, and then I'll conclude. By way of introduction, fibroids are non-cancerous growths of the uterus that usually develop during the childbearing years, and the childbearing years are taken from ages 18 to 45. And that's when a woman's female hormones are at their highest levels. So it's thought that fibroids are related to the female hormones. So they grow under the influence of female hormones. Oftentimes they may be asymptomatic, meaning the woman has no symptoms at all. But in certain proportion of women, they may show severe symptoms or even long-standing symptoms. And it's one of the reasons why we see a lot of gynecological admissions nowadays. This is just a pictorial representation of what fibroids look like. So this is the uterus on the left-hand side, lower aspect of the screen. The uterus is connected to the ovaries and is also attached to the tubes. Now, fibroids arise from the uterus itself. So they could arise from the surface, from the muscular layer of the uterus, or from the cavity, which is the innermost layer of the uterus. This is a little bit graphic for those who might not really appreciate the sight of blood, but this is what fibroids look like when they are removed surgically. So they have this appearance which we refer to as walled, meaning imagine something going in a spiral way. That's how the fibroids appear, but they are firm, sometimes hard when they are felt. Do you know that fibroids affect more than 30% of women by the age of 35 years? And that by the age of 50, about 70 to 80% of women are affected by fibroids. And it stands to reason why the ages of 18 to about 50, which are the reproductive years, are the highest periods where fibroids can be found. Like I earlier said, 30% of women will have fibroids by the age of 35, and most Black women, about 80%, will have at the age of 50. White women are not as commonly affected as Black, and as we go along in the discussion, we might be able to have some explanation to why this happens. Studies that have been conducted in Nigeria, however, have shown a higher prevalence rate of fibroids in the eastern part of Nigeria. Why this is so, research is yet to determine why we have higher rates from the eastern part of this country. What is the natural history or the progression of fibroids? Usually they develop from a single cell. So if you see multiple fibroids, they don't all arise from just one cell. Each fibroid mass arises independently of the other. They're dependent on estrogen, which is the major female hormone, which is high during childbearing years. During pregnancy, fibroids can increase in size, though not commonly, but if they do increase in size, usually within the first trimester, where the female hormone estrogen is usually at its highest level. So it's expected that fibroids would grow during that time. And people who are receiving combined oral contraceptive pills, because those pills also contain the female hormones, their fibroids might increase slightly, though typically they're to help with the symptoms that come with fibroids. And it's expected when a woman goes into menopause, which is the end of her reproductive life, that fibroids should regress because there's withdrawal or fall in female hormones. Rarely do fibroids transform to cancer. Now, what are the risk factors that have been associated with fibroids? Race. I did mention the Black race. So it's been found that Black women are at a higher risk of having fibroids. Research is still ongoing, but it's been postulated that there might be some genetic mutations that predispose Black women to fibroids rather than white women. And it's been found also that women who have a family history, either a mother or an aunt or a sister who has had fibroids, are 2 times more likely to have fibroids themselves. Obesity is also associated with fibroids because you have preponderance of a lot of fat cells. Estrogen levels are high in such women, and this also predisposes them to fibroids. Diabetes, hypertension also go hand in hand with obesity, and they form part of what we call the metabolic syndrome and predispose women to fibroids. If a woman has never had a pregnancy, she's also at risk of having fibroids. And older women are at risk of having fibroids. And that's why fibroids are commoner from the ages of 30 upwards. Though in recent years, fibroids are now even being found in women that are in their 20s, but commonly they are seen in women in their 30s. And nowadays, with women deferring childbirth till later on in life, we are beginning to see more of this occurring in women in that age bracket, 30 and above. Women with polycystic ovarian syndrome have also been found to be at increased risk of fibroids. So this is just a pictorial representation of what I just mentioned. Black women at risk, obese women also at risk. Age at first menses. It's been postulated that those who start their periods quite early, though the average age of commencement of menstruation for most girls is about 11 to 12, but some girls will start menstruating at the age of 9. So imagine a young lady who started menstruating at 9 and doesn't fall into get to menopause till about 52. So she has about 43 years of exposure, 43 years of menstruation. So those long years of menstruation, long years of exposure to female hormones can predispose her to having fibroids. Lack of childbearing, as I also mentioned earlier. This also just talked about what I had mentioned earlier, genetic factors. Then it's also been found that people who indulge in high alcohol intake and caffeine are also at risk of having fibroids. How do they present? Most times fibroids show no symptoms at all. In about 50% of women, they have no symptoms. In fact, most women will find out they have fibroids maybe during a routine scan, either when they're pregnant or if they have one need or the other, maybe a sudden onset abdominal pain, and then they just discover, oh, I have had fibroids, and they never knew when these fibroids came on. So oftentimes there are no symptoms at all. The symptoms a woman presents with usually is influenced by the location of these fibroids, where they are, their number and their sizes. So the sizes could range from the size of a seedling, like an orange seed, and it could be as large as a football, or could even be way larger than that. You can see women having abdominal girths or abdominal distension, and you may think, oh, is this woman pregnant? Whereas it's just fibroids. So fibroids can be really, really large, that sometimes they can be mistaken for pregnancy. And the symptoms often affect the quality of a woman's life. What are the common symptoms? First on the list is heavy menstrual bleeding. Women who have symptomatic fibroids. Now I'm going to be talking about those who have symptomatic fibroids. Their periods are heavy. They notice that when we say heavy menstrual bleeding, we mean that on the heavy days of a woman's period, she's changing her menstrual pad every 2 hours, not because of hygiene, but she's changing because the pads are soaked. And part of what constitutes heavy menstrual bleeding is the passage of clots. Ideally, menstrual blood has a substance within it that should prevent it from forming large clots. But when women who have fibroids, they will typically will see heavy menstrual bleeding. They will also see thick clots, large clots. So when a woman tells you that, oh, when I see my period, I see clumps of blood falling into the toilet, or I feel the lump as it comes out, you know that this woman is having heavy menstrual bleeding. They also have painful periods because fibroids, they are the distension they cause in the womb, the chemical processes they elicit will initiate a lot of painful stimuli. So they have a lot of pain. They have enlargement of their lower abdomen because remember, as we said, they are growths. So when they become significantly large, it manifests outside as outwards as an enlargement of the lower abdomen of the woman. Sometimes they may cause pain during sex, especially if they are located in the lowermost part of the uterus towards the vagina. So these women, when they're having intercourse, usually on deep penetration, they might experience sex. Reproductive issues with fibroids are not so common, but they can occur. What do I mean by that? Fibroids in themselves do not cause infertility or subfertility. However, sometimes when you have fibroids located within the cavity of the womb, which is where the baby stays, they can have problems with conception because those fibroids will inhibit implantation of an embryo. Number two, those fibroids will also cause widen the area of the uterine cavity, making the distance for sperms to travel to meet the egg much more increased, and that can also contribute to problems with fertility. But fibroids outside the cavity, that is when we get to that point, when we talk about the location of fibroids, do not typically cause infertility. Now, pregnancy complications can occur depending on the location of the fibroid. There are some fibroids where they are located during pregnancy can obstruct the baby's head from descending, and in such instances, they cause what we call malpresentations. But these are not common. A lot of women with fibroids will go on to have healthy pregnancies and deliveries. So these are part of the symptoms I was talking about: heavy bleeding, pain, pelvic pain. Another symptom they can also have is frequent urination or constipation. This is because of the pressure effect of the fibroid. The bladder is in front of the uterus. So when you have something enlarged, and because the uterus, the way the anatomy of the uterus is, you have the bladder overlying the uterus. So when you have a mass, that causes a lot of compression. So these women have frequent urination. They can also have problems with constipation. Sorry about this. Then they may become depressed in the sense that, imagine a woman who is having heavy menstrual bleeding. She can't go out. She's just restrained to her house because she's afraid of getting stained when she goes out. She's afraid of being soiled, or she is in so much pain. So a lot of women who have symptomatic fibroids, it affects their mental health most times, especially those who have very severe symptoms. They can also have bleeding in between periods. So a woman, for instance, sees her period on the 1st of December, and she has like a 28-day cycle, so she should expect to see on the 29th of December. And then maybe by the 14th or 15th, she suddenly starts to bleed, and if she bleeds like for the normal 5 days, that's an intermenstrual bleed. That's not normal. And fibroids can also give that kind of picture. This is what I was referring to as protrusion or enlargement of the lower abdomen. So a woman just notices that, oh, it's like the lower part of my waist size has increased. Maybe I used to be a 14, I'm now weighing 18, and it's not as if I've added so much weight. It may just be that such a woman may have fibroids. Oftentimes people will think, oh, I just added weight. Maybe I've added a lot of tummy fat. But if these women are examined, you'll find that they have fibroids. Now, I talked about the location of fibroids. So the uterus, that is the womb, has 3 major layers. The outer layer, which we call the serosa, the middle layer, or muscular layer, which we call the myometrial layer, and the innermost or the cavity, which we call the endometrial layer. So fibroids can arise from any of these 3 layers. So we have the subserosa, the one attached to the surface. This is the subserosal fibroid. The one in the muscle layer, the middle layer, are the ones we call the intramural, and the ones within the cavity are the ones we call the submucosal ones. Now, this just talks about the 3 types of fibroids I mentioned: the intramural one, the submucosal one. The submucosal ones are the ones that really affect pregnancy rates, because they distort the lining of the womb or the endometrium, making it impossible for implantation to occur. And even if implantation does occur, they increase the risk for miscarriage. Now, fibroids can also be located beyond these 3 layers. You can find fibroids in the cervix. You can find fibroids within the area surrounding the womb. So you can have what we call a broad ligament fibroids, and fibroids in different places within the abdomen, but commonly they are limited to the womb. Now, how do we make a diagnosis of fibroids? So from the history, a woman tells you, oh, my periods were normal, and all of a sudden they became heavy. I used to menstruate for 5 days, now I'm menstruating for 8-10 days. I am changing my pads every 2 hours. I'm bleeding in between periods. I'm seeing clots. When I wear clothes, my clothes get stained because of the volume of blood I'm losing every month. At the end of every period, I feel so weak and tired. So once a woman gives all those complaints, one already begins to suspect that this woman may be suffering from uterine fibroids. So when an impression is made like that, the next thing we'd like to do will be to examine this woman to see, does she really have fibroids? So commonly, we will want to do an abdominal examination to check. So the doctor will check the tummy of the woman, the abdomen of the woman, to see if there's any palpable mass. Some people will say, oh, I feel this hard mass in the lower part of my tummy. Once you feel that, you know that that's most likely a fibroid mass. And then the doctor might proceed to do a pelvic exam sometimes to be able to ascertain the size of the mass. So a pelvic exam could be internal, and that will involve the doctor trying to assess the size of the mass. Now, ultrasound is the major modality of imaging, and ultrasound involves using sound waves to be able to characterize the masses. So if a doctor suspects you have fibroid, the next thing they want to do after examining you will be to do an ultrasound to see where the fibroids are located. Are they located on the surface, which we call the subserosa? Are they within the muscle layer, or are they within the cavity of the womb? Now, the ultrasound could be an abdominal one, or an internal one, or a vaginal ultrasound. We call the internal ultrasound the same as a vaginal or transvaginal ultrasound. So this is how the transvaginal probe looks like. So if you get to your doctor's office and a scan is about to be performed for you, and a transvaginal probe is to be inserted, this is what it looks like. Usually, for those with very large masses, we don't need to do a transvaginal scan because an abdominal scan will suffice. But for those with smaller masses in whom their uteruses are not felt out of the abdomen, a transvaginal scan may be done. This is how, these are just images to show how fibroids appear on scan. So your sonographer or your doctor may point this, you can see these masses where the arrows are pointing to, that's how fibroids appear on scan. This is a fibroid mass also appearing on scan. Sometimes your doctor might ask you to do an MRI. An MRI is called magnetic resonance imaging scan. So it's a higher level of imaging, especially if you are being considered for other minimally invasive options of fibroid management. So an MRI might be indicated. Sometimes an MRI might be indicated if you have urinary symptoms and your doctor wants to rule out effects of compression on your bladder and on your kidney from fibroids. So an MRI sometimes may be indicated. How do we manage fibroids? Fibroids can be managed based on their location, the sizes, the age of the woman. Those are factors important. What's the woman's desire for fertility and what her pregnancy history has been, or what is being expected. Now, the management could be expectant. Expectant means you do nothing. For instance, you randomly find out you have fibroids. It's not giving you any symptom at all. You don't need to do anything. All you need to do will just be to follow up with 6 monthly scans to see how the fibroids are progressing. Expectant management can also be done for women who are also close to menopause, meaning a woman is she's almost 50 or over 50 with fibroids. You can just watch her because you know that once she gets into menopause, this fibroids would regress. Now, who are those we manage medically? Medically means that we're using drugs to manage the symptoms most times. And for these women, most of them might be mildly symptomatic. So it's not every symptomatic woman that has to undergo the surgical management. Medical management at this point, I will say it's not a definitive treatment. It's just for symptomatic relief of pain to reduce the heavy bleeding. And sometimes you may need to do medical management if you want to reduce the size of fibroid prior to surgery. For women who suffer low blood levels from fibroid, medical management will afford them the opportunity to build up their blood counts prior to surgery. We use medications, different medications. Sometimes the oral contraceptive pills can be used. In a way, this helps with the heavy bleeding and the menstrual pain they have. We also use some hormonal drugs, one of which is what we call the GnRH, which stands for gonadotrophin releasing hormone agonist. Sorry, these are just medical jargons I'm mentioning, but what it simply means is that we're giving drugs that will stimulate the higher center, which is the brain, to send message to another center in the brain to give a final message to the ovaries to produce the female hormones. So when you are stimulating the brain, you are telling the brain, okay, we don't have, we have we don't have enough levels of these hormones, produce more. And when the female hormones are now produced in higher amounts, they send a negative message to the brain that, okay, we have surplus, stop production. And in so doing, over time, the female hormones, their levels fall. And when they fall, the fibroids are deprived of the hormones. And so they don't grow, they don't enlarge. And then the symptoms become manageable and tolerable for those women. We also use some drugs like antifibrinolytic drugs. What it simply means is that, like I said, menstrual blood usually contains a substance that should prevent clotting. So in women who have heavy menstrual bleeding, you want to give them drugs that will also help counteract, because they form excessive clots. You want to give drugs that will counteract that. An example of that drug is tranexamic acid. So if a woman is having heavy menstrual bleeding, sometimes her doctor will prescribe that. Pain medications can be given because in part of what happens as part of the reasons for pain in uterine fibroids, there's a lot of inflammation. So non-inflammatory, non-steroidal inflammatory, anti-inflammatory drugs can be given. Sometimes an intrauterine system or an IUCD can be put in to help fibroid management. This is what an intrauterine system looks like. How do we manage fibroids surgically? Surgically, fibroids are managed in two ways. Number one, you can manage them minimally using a minimal invasive approach or using an invasive approach. At this juncture, I also will say that Surgical management of fibroids depends on the woman's desire for fertility. So the title of our seminar is Conserving the Fibroid Uterus. So for uterus sparing surgeries or uterine sparing surgeries, myomectomy is what is indicated. That is removal of fibroids, leaving the uterus behind for the woman to be able to achieve a pregnancy. But for a woman who has no desire for fertility at all, who has completed her family size, hysterectomy, that is total removal of the womb, is what is done. But the emphasis of this seminar today is talking about conservation. So we're going to be hearing a lot about myomectomy. Myoma means fibroids, so removal of fibroids. And it can be achieved through either the minimally invasive route, meaning that we can do what we call a laparoscopic fibroid surgery, a laparoscopic myomectomy, a hysteroscopic. Hysteros stands for uterus or womb in Latin. So meaning that you're taking fibroids out of the womb through a telescopic method. Then we also have the robotic myomectomy. Open myomectomy is invasive, meaning you're cutting open the woman. All the other options I mentioned earlier on are minimally invasive, meaning you're using very tiny incisions to be able to bring out fibroids. My colleagues will talk about the various options. So this is just to give us an overview of what these options entail. So this is what laparoscopic myomectomy looks like. You have telescopic instruments passed in through little cuts in the abdomen, and then the surgeons go in and then cut the fibroids, bring them out. And so this helps a woman's recovery because you have minimal incisions, recovery time is faster, and even the requirement for blood transfusion is also reduced in this kind of surgeries. Hysteroscopic myomectomy is indicated for those who have fibroids within the cavity or submucosal fibroids. What it means is that a telescope is passed through the cervix into the uterine cavity, and then you have the fibroids removed. So this is how the hysteroscope looks like. It goes in, this is the fibroid, it removes, and so this is usually done on an outpatient basis and usually is advantageous to those who have fibroids within the cavity of their womb. Robotic myomectomy is not available in this part of the world, but in some parts of the developed world, a robotic myomectomy can be done. What it just involves is that you have an operator, the surgeon using various controls, robotic controller, to be able to perform the surgery through minimal incisions as well. Now, there are other newer techniques that are available, but some of them are not readily available all over the world. One of which is UFE, uterine fibroid embolization. I think we have this now available in Nigeria, but there are certain criteria that qualifies a woman to be able to undergo uterine fibroid embolization. What it means is that some certain chemicals are injected through one of the major vessels in the body to be able to, especially the one that supplies the uterus, and in so doing, you're blocking blood supply to the fibroids. It has its benefits and also has its disadvantages. Then we also have the MRI-guided focused ultrasound therapy, using high-level sound waves with MRI to be able to burn up fibroids. So this is what uterine fibroid embolization looks like. A catheter or like a conduit is passed through a major vessel in the leg of the woman, and some chemical substances are injected, and this finds its way down to the uterine artery, which is the major blood supply of the uterus, and this starves the fibroids of their blood supply, and over time the fibroids regress. Now, this is this is just what the machine looks like. We call this the MRI-guided focused ultrasound therapy. So this involves delivering high-level sound waves to be able to burn fibroids. Now, what are the myths about fibroids? I'm sure many of us would have heard certain things about fibroids. Some will say, oh, fibroids, they hear fibroids are cancerous, but that is wrong. Fibroids are benign tumors. They are not cancerous. and they don't have consistent defined symptoms, meaning that not everybody will experience heavy menstrual bleeding. Not everybody will have painful menses. For some, it may just be frequency of urination might be the only symptom they may have. Now, some will say, oh, surgery is your best option. That's not true. There are other methods of management of fibroid, as we have mentioned. Some also say that taking ginger will help naturally shrink your fibroids. Well, that has not been proven by research. But what we know, or what research has pointed out, is that diets high in red meat might be associated with uterine fibroids. Some say, oh, taking a special diet or inserting certain things into your vagina to help dissolve those fibroids. There are things that will help you with fibroid treatment. Please, these are very wrong, and be very mindful, because some people, in the bid to dissolve fibroids, cause more problems for themselves, because they will insert caustic substances in that will give them much more problems than the fibroids themselves. And fibroids, like I said, don't cause infertility, but sometimes, in some instances, may be associated with it. And there's also a myth that if you're not having regular sex, you go have fibroids. That is also not true. What is the stigma women with fibroids face? Some of them, like I said, a woman having heavy menstrual bleeding during her period, she can't go out. She can't go to work, she can't socialize, she can't, meet up with friends. So for most people, it tells on them, their social life, their mental health. In fact, relationships can become strained, because imagine a woman having a tummy as large as, let's say, a 7 months or 8 months pregnancy. For some of them who don't have understanding partners, intimacy might become an issue, and that can put a strain on the relationship of the woman. Other things that can affect a woman is the fertility potential of the woman may be called to question. People will say, oh, this one that you've had fibroids, or if you've gone through fibroid surgery, will you ever be able to have a child of your own? So those are some stigmas that make women with fibroids defer any form of treatment until when it's gotten out of hand, and all because they're trying to avoid stigmatization. So how do we eliminate that? Like the First Lady said, we need to speak up. If you're experiencing fibroids, don't keep quiet, don't remain in silence, especially if it's giving you symptoms. Speak up, talk to your doctors, talk to people who you know can help you find solutions to your fibroids. And also, the month of July every year is the Fibroid Awareness Month. And so a lot of non-governmental organizations also try to enlighten people about fibroids. Most recently, a bill was considered for fibroid research in the United States. A lot of money was put into that to be able to help find out the genetic basis of fibroids, especially in Black women. And we're hoping that once this research is completed, at least there might be some further good understanding as to why Black women have fibroids and how that can be targeted in the future to help reduce the risk of this occurring in women. So I mentioned July is the month of fibroid awareness. Fibroids impact a lot of people who suffer from them. About 75% of those who suffer from them have a lot of their quality of life affected. In conclusion, fibroids remain one of the commonest reasons why people seek gynecologic consultations and why they're hospitalized. It could be symptomatic or asymptomatic. Fertility preservation via myomectomy for those with symptomatic fibroids is actually ideal. Surgery could either be minimally invasive or invasive. Eliminating the stigma via awareness will go a long way in tackling this problem. Thank you for listening.
Thank you so much, Dr. Becker. That was really informative.